Hello, good afternoon. My name is Ozioma Unwosu, and I'm a student of the University of North Florida in the Psychiatric Mental Health Nurse Practitioner Program. I'm doing a mock counseling session, and this is in fulfillment of an assignment for my class, my mental health counseling class with Professor Thomasina. I must add that the characters of both the therapist and the client or patient is purely fictitious, and any resemblance with any person, living or dead, is purely coincidental. Okay, Mr. Edwin Awokoya, welcome to this session. It's a pleasure to meet you.
Thank you.
We have water, we have tea and coffee. Please make yourself comfortable.
Thank you very much.
You're most welcome. Okay, first of all, I want you to understand that you are being recorded, and this recording is going to go on Facebook, on YouTube and Facebook and other social media platforms. Your image will be used. Do I have your consent to do this?
Yes, please.
Perfect. Also, I want you to understand that the session is confidential. However, there are situations where confidentiality has to be breached. For instance, if I have reasonable suspicion that you are a danger to yourself or to others, then by law I am mandated to speak up. Or if I have to refer you to another therapist or to another clinic or place, I would have to share some of your information with them. Do you understand the confidentiality clauses?
Yeah, I do.
Perfect. Also, most times when we have to share information about you, you have to sign a release that allows us to release that information. Do you understand this?
I do.
Do I have your permission to tape, record, and to disseminate this interview on YouTube and other social media platforms?
Yes, I do.
Thank you. Okay, so Mr. Edwin Awokaya. Edwin Awokaya, welcome again.
Yeah, thank you.
Can you tell me what brings you in to this session?
Yeah, basically I was referred by the psychiatric clinic, to come to your clinic basically for this session.
So you were referred to me by a psychiatric clinic or psychiatric hospital.
Yeah, basically, yeah, the hospital basically.
Okay,
Where
so
I was on admission.
you were on admission. For how long were you admitted?
I was admitted for like 5 days.
5 days in the hospital.
Yeah.
Okay, and what exactly led up to that admission?
Yeah, I just woke up and I saw myself in the hospital. And I was like scared, like what happened, like made me to be here. And I was told by one of the nurses that my roommate called 911
Okay.
because I was unresponsive and they had to like rush me down to the hospital. So that was what brought me down there, and this is what ended up leading me down, to meet with you today.
Okay, so your roommate found you unresponsive and then called 911 and they took you to the hospital. And at the hospital, you spent 5 days in the
That's
hospital. Can exactly what was your diagnosis? What did the hospital tell you was the issue? And why did they have to keep you for 5 days? Do you have any understanding of this?
I think it was an attempt to like suicide basically,
Okay.
and that was what really led to them, keeping me in the hospital for those number of days, till when they felt I was good to go to continue my therapy basically with you.
Okay. So the hospital kept you for 5 days because you had a suicide attempt. Can you tell me more about this suicide attempt?
Well, basically what happened was that I overdosed basically with painkillers. That's all I can say.
Okay, so you overdosed with painkillers. What kind of painkillers?
Acetaminophen, Tylenol.
Tylenol. Was it
Yeah.
deliberate or was it an accident?
It was a deliberate attempt to end my life.
Okay. So if I'm hearing you correctly, what you're saying is that you wanted to end your life, and so you took a whole bunch of acetaminophen, and you were unconscious, and you went to the hospital. Am I hearing you correctly?
That's correct.
Okay, okay. Now, Mr. Awokoya, please, could you tell me about your life or the few weeks and months preceding this whole Tylenol issue and hospital issue? So, how was your sleep? How was work? Were you stressed? What kind of stress were you experiencing? Did you have any, issues that were coming up in your life and things like that? Can you spread more light about your life, days, weeks, and months just preceding this whole suicide attempt?
Yeah, I would say like I've been going through a lot of stress within the last 3 weeks,
Okay.
and it has also impacted on my academics.
Okay.
Basically, what happened was that I got to a point in my life that I said that I'm going to stop living the life of denial,
Okay.
and I need to be bold enough and come out and tell the world who I am,
Okay.
rather than living in my closet, basically.
Okay.
So in all honesty, I'm a homosexual, so I'm more like into men than women, basically.
Okay.
And I shared my experience of what I'm into or my new sexual identity with my cousin, who happens to be my best friend.
Okay.
And we grew up way back in Nigeria. His dad happens to be my dad's younger brother.
Okay.
So we are childhood friends. We share lots of information together, secrets and all that. So I felt like he is the best person that I can, share my new identity with. And when I, called him up to, let's meet up somewhere and discuss. And I told him about it. He broke down, he cried and everything. But I said it was not something that he should cry about. Like, this is who I am, and this is what makes me happy.
Okay.
And he was cool. But just recently we had a fallout, and he threatened that he's going to call my dad in Nigeria and my family and let them know that the purpose that they sent me to the US for, according to him, was a failure, that I'm an homosexual.
Okay.
So when he threatened me and said he's going to do that, I broke down and slipped into depression again. And I concluded that if the person that I choose to trust and the person I love so much, and we are blood, and he could do this to me, at that point I said, it doesn't make sense to be alive anymore. And that was where I concluded that I'm going to end my life.
Oh, I see. So essentially, you had a lot of anxiety and fear.
True.
And that is what spurred you to try to end your life.
That's correct.
Correct. Is this the first time you've tried to end your life?
Basically, this is actually the first time that I summoned the courage that my life was worthless.
Okay.
And it doesn't make sense to be alive anymore.
Okay. Do you have any history of a mental health issue? Have you ever been diagnosed with, that depression, schizophrenia, bipolar, PTSD, and all those kind of things? Has it ever happened in your history?
Yeah. Honestly, remember, like I said, I moved from Nigeria 5 years ago.
Okay.
To come here to further my studies, and I happened to be in the Ivy League school.
Oh, beautiful. wonderful.
Yeah.
What are you studying?
Yeah, chemical engineering.
Oh wow!
Yeah.
What year?
Yeah, I'm in my final year.
You're in
Now.
your final. Oh, that must be really stressful.
Yeah,
You
that's
know.
true.
Mm-hmm.
That's true.
And how are your grades? How's your study coming along?
Oh, I'm doing well. I'm doing well.
You're doing well.
So
Okay.
basically, what happened was that when I moved into the States, trying to acclimatize into a new environment, and it's really tough. And it was really a tough one for me because switching from the British system of education to the American system of education was really a tough one for me, and it was so stressful. And I had to meet up with my counselor, and she referred me to see a psychiatrist, to help me out because at that point I felt that I was losing it because so much had been invested in me, and I can't fail at this first day.
Okay.
And I met with the psychiatrist. They placed me on medication and all that to, ease me of the depression. And I was able to outrun it, and I started doing better, and I adapted it. And today I'm in my final year.
Oh, good for you!
Yeah,
Congratulations.
thank you.
That's really good. So you were diagnosed with depression,
That's correct.
and you took medications. Did you have therapy?
Yes, I had a therapy session.
And
Yeah,
and how was your experience with therapy?
yeah, it was a good one.
It was good. Okay,
Yeah.
okay. And prior to this hospitalization in the psychiatric hospital, had you ever been hospitalized in a psychiatric hospital?
No, not at all.
Not at all. Okay, okay. Now, currently, do you feel like hurting yourself or hurting any other person?
Yeah, I I must confess, before the therapy session,
Mm-hmm.
maybe I could have hurt myself. No, but not necessarily any other person around me, but myself. But when I came to the hospital and I met with this psychiatrist, they were able to share their life story with me and tell me that there's still a better side of this life, which is beautiful. If only I can learn to identify it, appreciate it, and love it.
Mm.
That suicide basically is not the way out. Ending my life is going to put more people in jeopardy, pain, possible depression, and it might lead to death of family members who cannot withstand the thought that their beloved brother or son committed suicide. They gave me a new meaning of life itself from what I thought it was. And at that point, I came to a conclusion that ending my life is not worth it.
Mm.
That I'm going to stay alive and fight
Okay.
and let the world know this is who I am. And I'll be proud and be proud of what feelings I got inside of me.
I see.
And that's it.
Okay. Okay. Um. Um. About your family, is there any history of mental health issues in your family?
No.
No?
Basically, no. There's no.
So no
issues,
depression.
depression, no. You see, this is not what I like to talk about, basically.
Okay.
You know, I'm just going to share some private part of me, basically.
Okay.
I know you might be wondering, a guy coming from a third world country and he's able to come to the US and he's in the Ivy League school. Just imagine the fees as an international student, basically. There's a lot.
Mm-hmm.
I'm from a very wealthy family, basically. My grandfather, going by precedent, my grandfather, he was the Chief Justice of my country where I was coming from. And my mom and my dad,
Okay.
they both have PhDs,
Okay.
and we're from a very rich family. Interestingly, my father is a man of God.
Your father is a man of God.
Yeah, he is a man of God.
Okay.
And he has one of the biggest churches in Nigeria and in Africa. Africa happens to be the continent.
Oh, I see.
Yeah, and a lot has happened in my family, and I was privileged to know about it, even when they try to keep it within themselves. It was alleged that my grandfather, yeah, he committed suicide.
Your grandfather, the Chief Justice.
Yeah, the Chief Justice. Yeah, he committed suicide, and they tried to sweep it under the rug, and they said that he died in his sleep, just trying to cover it up, and they ended up giving him a state burial. My dad's younger brother, he's married with 4 kids.
Okay.
But interestingly, he's a gay guy. He's homosexual.
Interesting.
Yeah, but I heard my dad and my uncle's wife talking one day in the sitting room.
Okay.
And I was in the bathroom, and I kind of eavesdropped in their conversation, and I hear my auntie crying and weeping and telling my dad that her husband is homosexual. So they just try to keep it within the family and all that. So basically, that's what has happened.
So, from what you're telling me, it seems like there's a lot of secrecy, a lot of, shame as regards, mental health and suicide in your family.
See, not necessarily my family. It's just like a cultural thing from where I'm coming from.
Okay.
It's like a taboo for you to wake up and say, "Hey, I'm depressed." It's not something you say, because if you Google Nigeria,
Okay.
it will tell you that it's one of the most happiest nations in the world. We're always smiling even in the midst of difficulties. And for you to come out and say you are homosexual, they're gonna kill you.
Oh,
Yeah,
okay.
you can end up losing your life for you to just identify or to see you and a guy walking up the street holding hands together. That could be death.
Oh.
And my country where I'm coming from, they don't support it, and it's in the law that the government of Nigeria is against homosexuality. You know,
Okay.
so it's something like you don't want to say it out. You don't say it in confidence, and I mean you don't say it in the open. Neither even when you want to share with somebody that you trust, you have to make sure that it's somebody that you trust so well. That that you could disclose such information to.
You seem to be very anxious talking about this.
Yes, that's true because you know I don't like to discuss so much about it, but because of the principles of this session and with the intent that this session is going to make me a better person, and that's when I concluded there was no need for me to lay back any information or restrain any information from you, and that's why I'm opening up to you on everything.
Oh, thank you for trusting us.
Yeah, thank you.
Okay. What has been the major crisis in your life, in your family, in the last 1 to 5 years, and how have you handled them?
Basically, there's no significant crisis apart from the one I shared with you that affected me academically when I moved to the US.
Okay.
Yeah, it was that the only major crisis that I've been involved with. Besides that, nothing else.
Nothing else. Okay. Do you have any current or previous health problems? Any health issues, injuries, illnesses, allergies, eating patterns, exercise, sleep, sex? Any health problems?
Yeah, everything looks good. The only time I feel like I have any challenges when I turned 18 years.
Okay.
We Africans were very, very strong and we hardly fall sick. And the only time I feel like I had any challenge was when I turned 18 years, and 3 days after that, I had to do appendectomy basically.
Okay.
And that kept me in the hospital for 2 to 3 days, and after that I was fine.
Was that in the US or in
No, it was in
Nigeria?
Nigeria. You remember I told you I left Nigeria at the age of 20? I'm 25 now.
Okay.
So it was on my 18th birthday,
Mhm.
basically like 7 years ago, basically.
Okay. Any history of substance abuse? Alcohol,
Oh,
marijuana,
oh no,
cocaine?
no, 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 no. I told you, I said my dad is a pastor. He
Okay.
has one of the biggest churches in Nigeria. And trust me when I say my dad is a pastor, we were raised in the church.
Okay.
And in a regular Christian family, basically, like they go to church like twice a week. But for me, we go to church 5 days a week.
5 days
So
a
the only
week.
days that is like when we don't go to church is on a Saturday and on a Monday. But every other day, we're in the church. So I never see my dad drink, smoke, or any person in my dad's family because they are all Christian. So trust me, I haven't drank or smoked in all my 25 years on that.
Oh, I see. Okay. Okay. Um, so you've never used in the past and you're not using any right now?
No, not at all.
No. Okay. So do you have any legal issues? So any problems with the police, any case in court, anything of that nature?
No, 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 no. It hasn't happened. I'm a law-abiding citizen of this country. What I mean citizen, I mean law-abiding student here in the U.S. Basically, you know, I follow the rules and regulation, and even for as low as speeding ticket, I haven't gotten one. I try to abide by the rules and regulation that governs the land. So I don't think I have any legal issues with anybody, or not that I'm aware of.
Oh, I see. Okay. Tell me about your childhood history. So were there anything significant, anything that, points out like a sore thumb, maybe were you ever diagnosed with autism, or did you meet all your developmental milestones? How was school? How was family? Any trauma? Anything that is, significant in your childhood?
Basically, I must say that my childhood was fantastic. No sign of illness or whatever. I was a smart child. My mom told me like I started walking at the age of eight and a half months. I was already walking around. She even told me like at 2 years I was already reading and all that. I was reading. When I mean reading, I was reading poems and all this stuff. I was that smart. That's why I'm sure you're not surprised that I'm in Ivy League school today. You know, so for my childhood was okay. Even though when I was a little boy at age 5, I knew that something was wrong with me.
Okay.
Yeah, because I had this kind of feeling. There was this guy. His name is Chike. He was one of the pastor's son that reported to my dad. He was one of the junior pastors. I love Chike so much. I could see him in my eyes, like in my mind.
Mm.
He was fair in complexion.
Okay.
Chike was so handsome. I love Chike. But there was no way I could tell him how I feel.
Mm.
Because it was not something that is expected of any young man, or even at that age, to start developing feeling for his own same sex.
Mm.
It was really tough.
Mm.
It was a guy that if I had an opportunity today to get married to, would have been Chike.
I see.
But you see, it was not something that was permitted where I was growing up. And that's why I thank God today that I found myself in the land of the free America, where you have opportunity to become who you want to be.
Okay.
No restriction,
Mm-hmm.
freedom to express yourself.
Mm-hmm.
And that's why coming to the US has been a blessing. And that is why today I'm not really shy about my new sexual identity.
Okay. What was your peer group experience like? Did you have any friends growing up? Did you have a best friend? And you just talked about Chike. Any other?
Yeah, I do, but Chike was just a spectacular guy. I haven't come in contact with him for years, but I could still picture him in my childhood memory.
Okay.
Yeah, but besides that, everything was good.
Everything was
Only
good.
that during my childhood and during my stay in Nigeria, I never had any female friends.
Mm.
But nobody could even understand why I was like that. But you were just me
It
because I
was
kept
just
it to myself.
you kept it to yourself.
Yeah.
And what about school? How was it?
Yeah, school was
Elementary
okay.
school, high
Yeah,
school,
everything was good.
everything was good. Okay. And do you have any children?
Oh no,
No
no, yeah, no,
children.
no.
And right now, are you married, single, separated, divorced, widowed?
You know something beautiful happened
Oh,
this
really?
last summer.
Okay.
Yeah, me and my boyfriend.
Uh huh.
Yeah, I'm sure you know his name. Can you remember his name?
James.
Exactly. Yeah,
Okay.
James. Yeah, me and James. This last summer, we went to Arizona and went on hiking,
Okay.
and something happened to me, and that is the day that I will never forget.
Okay. Tell me, what about it?
Yeah, James proposed.
Oh, congratulations.
Yes, we will be getting married um, in no distant time, but we haven't been able to like put everything together and everything. But that's one of the best things that happened to me this summer.
That's wonderful. Um, no children.
No,
Any family history of physical or emotional problems?
no, not serious one except what I shared with you about my
Okay.
grandfather and my uncle.
Okay. So, do you have friends, and except from James, of course, do you have other friends and associates in your life?
Yeah, just few friends, and apart from that, couple with the new friends I have now,
Hmm.
the LGBTQ community, you know.
Oh, that's nice.
Yeah, so I'm able to identify with other people that are like in similar love situation
As yourself.
as myself,
Do you
basically.
belong to any clubs or organized activities?
Yeah, just the LGBTQ community, basically, that's where I feel like I identify, get my strength, socialize, interact with them, we go for hangouts, you know, go for events, talk shows, healthcare, and all that. You know, where they came, there was one that I witnessed, like, you know, they came and they told us the possibility of gay couples, you know, having children, and that was like one of the best things that happened to me in my life.
Oh, wow.
Yeah, I was so happy about it.
Wonderful.
Yeah,
Okay. Do you have any leisure activities that you enjoy?
yeah, just me and James basically we go out to the movies, hiking, swimming, you know, do some cookout together, read
Okay.
books.
And is religion important in your life?
Yeah. I would say religion is very key because it talks about the way of life, the way we live our life and everything.
Hmm.
You know, but you know, the challenge I just have about it is the church itself in correlation with my newfound faith.
Okay.
Because Jesus loves me, God loves me for who I am. But the church, they don't look at it from that perspective. They feel like because of I'm gay, I came out, I'm homosexual and everything, and like, you know, they're like, they look at me like, hey, this guy is gonna go to the lake of fire and all that. But nobody wants to accept me for who I am and show me love and support me for my new found identity. You know
Mm.
what I'm saying?
Hmm.
So that's what basically really happened.
Mm. I see. Okay. And so you identify as Christian from
Yeah.
your upbringing.
Oh yeah.
Okay. And you don't. And do you feel like your sexuality is in contrivance with your faith?
You know, like I said earlier on, for me, I see that God loves me,
Mm-hmm.
and that's why He died for me,
Mm-hmm.
and He loves me for who I am, even my newfound faith. But the problem I have is the church.
Okay.
They don't want to accept us. They condemn us. They talk at us. They use us to preach and all those kind of stuff, talking about Sodom and Gomorrah and how God destroyed Sodom and Gomorrah because of their gays and all this kind of stuff. You know, but I'm like, those are those days. This is a modern age, you know.
Mm.
I feel like being gay is also what God wants for me, basically.
Okay.
Because if He doesn't want it for me, He wouldn't have put those feelings, those hormones inside of me. And
Okay.
I'm happy and I'm proud for who I am,
Okay.
and I'm happy that I'm gay, you know.
Okay. So what I'm hearing you say is that personally, you have no problems with your sexuality.
Sure.
The problem is the perception and of other people, the church, and outsiders. Is that what you're saying?
Correct.
Okay. Okay. Are you employed? right now?
No, I'm just a student.
You're just a
So,
student. Okay. Okay.
but I used to work before in one of the stores, and now I'm an attendant in the library, and I also like I also tutor also.
Oh, good. Good for
Yeah,
you.
thank you.
Okay. Any past history of any trauma? Somebody died, somebody you loved died, dog died,
No, 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 no,
family.
no,
No.
no, not at all.
Has anybody tried to hurt you in the past, or okay?
Not that I'm aware of.
None. Okay. Any history of sexual abuse?
No,
No. Have you ever experienced or witnessed or been affected by violence?
no, not at all.
Okay. And no trauma, like you said before. Okay. Okay. So, if I'm hearing you well, what I'm hearing you say is that the problem you're having that spurred you to go and uh, to try to end your life is about guilt, is about shame, is about fear. And it centers about around your family and your community, your family and the Nigerian community and their perceptions towards being towards your sexuality. Did I hear you well?
That's correct.
Can you expand more on that?
You see, going from where I was coming from, and my dad being a pastor, and
Okay.
my mom also a pastor in the church, and my new sexual identity. If they hear about it, my father could kill me, basically.
Okay.
If my father does not kill me, people in the church will. If they don't, the members of the community will
I see.
do so. And it comes with a lot of stigma, mockery, and all that stuff. And my my siblings feel that they're gonna live in shame because they'll be making a mockery of them, like your brother left Nigeria, and all he could do instead of focusing on his studies, also become an homosexual.
Mm.
So this is something that my siblings are gonna live with, and my parents are gonna live with all the days of their life. I'm even scared, like there's a possibility that this could kill my family members,
Okay.
basically because of people will be like, this is a taboo. So they're like, even people might be planning some vicious attack against my family members. Because if I declare myself to my family, I want to tell you guys that my family will not be safe anymore because of the ideology that homosexuality is a taboo. They see like evil. They don't see like this is part of who you are and this is your lifestyle basically. They don't want to like appreciate you and accept you for who you are. And because it takes a lot of time for somebody to sum up the courage and define who he is basically. So it's kind of really tough.
I
So
see.
that's a challenge.
That's a challenge you're facing.
Yeah.
And I think with the problem that you're having with your cousin,
Yeah.
problem you're having with your cousin, and at the end of your studies, there's a plan for you to return back to Nigeria.
That's correct.
So this even makes it even more serious, more significant at this point in time. And I think that I think that is what actually spurred you to try to end your life.
That's correct.
Correct? Okay. So I think we have to deal with how to help you to deal with this social religious issues that you're facing. And I would like to add at this point that you're not the only one. There are so many people who find themselves in this kind of situation. Although you seem to be you seem to have a much more extreme case, but different people are going through this situation in varying degrees. Okay, some more than the others, and there are lots of resources in the community to help you to deal with these problems that you point out. What I will do is to refer you to a support group where you can help you to how to come out of the closet and how to deal with the social issues that will come when you actually decide to come out of the closet. So that's one part. But today, in today's session, this being our first session, what I'm much more concerned about is your safety. I'm concerned about your safety because you have tried to commit suicide. And for most people that are successful in committing suicide, it takes several attempts. Plus, you seem to have a family history of depression and a family history of suicide. And there's a genetic component to this problem. And so, what I'm trying to achieve for this session right now is your safety. Okay, there are a lot of community resources that you can use to, help yourself. Now you say that you don't feel like committing suicide at the moment. You did in the past, but not at the moment.
Yes, no. Because after the quality time, like the psychiatric doctor spent with me in the hospital, and even the time I've spent with you, I don't feel like there's any need anymore to think of ending up my life with overdosage of drugs or whatever.
Okay.
Now I'm beginning to appreciate the life, the God-given life that I have today, because it's an opportunity to be alive, and because many people are in the hospital. So I begin to see the bright side of life, basically.
Okay.
And it was at that point that I concluded, like, this doesn't worth it taking my life, but rather summing up courage and telling people this is who I am, and let people appreciate me. Even when people don't appreciate me, it's not going to change the dynamics.
Okay.
It's all about me. It's all about making myself happy. It's all about living my life to fulfillment.
Okay.
And all that. So this is the path I have chosen, and this is what I intend to do.
Oh, beautiful. Yeah. I'm so happy that you are at this point. But I want you to realize that there are going to be moments of weakness. Okay? There are going to be more in your personal moments. There, if this whole issue of your cousin snitching on you and telling on you, if it comes up again, there's a good tendency for you to become depressed again. And there's a very good tendency for you to try to want to end your life. That's why what I'm trying to do now is to give you resources, give you the skills and the tools to use to assure your safety. Now, I'm here 8 to 5, Monday to Thursdays, and you can always call in. We also have the National Suicide Health Hotline. They're open 24 hours a day, 7 days a week, and you can always call them. Plus, you can always also go to any emergency room and check yourself in. So, I want us to have like a verbal contract, a verbal agreement,
okay,
that should it happen that, you feel like ending your life, or again, that you would use one of these resources. So you either call the National Suicide Hotline, or you check yourself into any emergency room, or you call my office. Can you give me that?
Yeah. I give you my word, basically. Yeah. I don't see myself going towards that line anymore because I've been able to build my thought process. But if something like that comes up, definitely I will call the emergency hotline, or I will call your office. It was within your office hours, basically.
Okay.
To talk to somebody about it.
Okay. Or you go to the any emergency room and just check yourself in.
Correct.
Correct? Fantastic. Thank you for that. Okay. Now, from our interview, and this is our first session, I was able to identify some issues. First of all, the cultural issues, cultural perspectives towards depression and anxiety.
Okay.
And also, family problems with your family in terms of coming out about your sexuality, and the fear and the anxiety that you feel. These are things that we're going to work with you on in subsequent sessions, and I will also avail you with more information.
Right.
So, being that this is the first time I've seen you, and because how severe your case is, I would like to see you more often. And once we're able to establish...
Yeah, not a problem. Basically, what I would do is that I would check my schedule, basically, and once I'm able to look at my schedule, and luckily you're 15 minutes away from where I live, so I'm going to call your office and communicate with you my schedule, and we'll settle an appointment when we'll be coming over to meet you.
Oh, thank you so much, Mr. Edwin Awokaya. It was such a pleasure meeting you.
Yeah, sure, you're welcome.
See you next week.
All right, thank you so much.
You take care.
You have a good one.
Bye-bye.
Bye-bye.